Challenger. Today's kind of a bonus segment. I hate to use the word bonus because it's a morbid subject we're going to be talking about. But I didn't number the episodes right, so we're out 104, 204. We're actually out of, this will be the 5th video in the series. So it's really 5 videos. Today we're going to talk about the final or the ultimate stage of degeneration. Now, I've been practicing in this facility for over 10 years, and I've only seen one case walk through my door which was a real true phase 4 degenerative change. We're going to talk a little bit about why that is in a minute. But before I get into that, I want to show you what it looks like. Now, I don't even have a model of one, but if you picture 2 vertebrae, and there's a disc between them, the disc is gone because the vertebrae have degenerated the disc with osteophytes growing out over the discs on both sides. So the bottom vertebrae and the top vertebrae have bone spurs that have kind of started to touch in phase 3. Now what they've done is they've cemented themselves together. And the reason they do that is because the neck, which is typically the first area it happens, is trying to prevent the head from literally falling off the body. Okay, because the head is the weight of this bowling ball here. Okay, it's 10 to 12 pounds on average, very heavy. Okay, and the spine that it sits on is much, you can't really feel this on a video, but it's much lighter. Okay, 5, 6, 7 pounds maybe. And the only way the spine can hold the bowling ball is by having curves in it. It acts like a spring or a shock absorber to hold the bowling ball. So when curves get lost due to degenerative change, what will happen is you go through those phases that we talked about in the other videos, and eventually his posture will start to do this too. He'll start like here, and then he'll go to phase 1, and then he'll go to phase 2, and then 3, and you've seen people like this, okay? And actually the weight of this head should fall off the body, but what happens is the brain is so smart, it tells the bones in the middle of the neck, or the lower neck and the upper thoracics, to produce more bone, okay? So they grow more bone to strengthen this area to prevent the brain from literally falling off the body, or the head to go forward, okay? So it does that to hold the brain up, but it's at the expense of making you very sick, because what happens is when those bones cement themselves together, they destroy discs and nerves. Now we're going to talk about why I don't see this very often. Now, you can imagine that the person is very immobile once this starts happening in your spine. They're typically older. I have not seen, but they don't have to be like 90. They're not ancient. They're not 90 or 100 years old. I think the one case I've seen, he was in his 70s. So it can happen at different ages. Age is a factor, but it doesn't define it. So let's talk a little bit about why this is killing people, and it's one of the #1 causes of death in the United States. And here's why. It's because we all know that heart disease and heart attacks and things are what kill people. I want you to take a look at the bottom of the neck here, where these bones are fused together, and then we're going to look over here at the nerves, where the nerves come out of there and where they feed. Okay, so here's the brain up here, and the information comes down the spinal cord from the brain, and it comes out, this is the bottom of the neck. Now if I fuse these together, look where these nerves go. Look what 2 organs they feed, heart and lung. So we all know that if I took scissors and clipped the nerves, that these would die. We can all agree on that, right? Okay, so if we don't cut the nerves, but instead we get rid of the discs and destroy the holes that the nerves come out of, and the bones close up around the nerves, that's like stepping on a hose, and it shuts down the ability of the brain to talk to these organs. So you get heart attack, you get arrhythmia, you get chest pain. Typically they're going to have shortness of breath, pain when they breathe. They're going to be chronic coughs when they're stooped over. Well, you've seen guys like this. They're walking across the street. They're not going, yeah, I'm having a great day. They're typically going, they can't breathe. Okay, and it's because they're losing function to these two organs. It's one of the #1 causes of death in the United States. And as Americans take more jobs where they're seated long hours in front of a computer, long hours in traffic, with their head in forward flex positions, we've seen heart disease going up and up and up and up and up. Okay, and no one's checking the cause of the root cause of the nerve that controls the heart. This is why these people in phase 4 should have gone to the chiropractor decades ago to prevent this from happening, because if those bones move, then you don't have this happen. It's when they lock up and fixate. That's when degeneration and arthritis sets in. Okay, so this is so critical and so important that everyone get checked, their spine checked for this. Because it can be prevented 20, 25 years before, when they lost that curve in the car accident that they thought was a small car accident, and they didn't even go to the hospital because they didn't have that much pain. But really they lost the curve. This can happen at 4 miles an hour. That's all it takes, 4 miles an hour. Okay? And then 20 years later, 30 years later, they've gone through this pathway. And I can't do a correction here. Once a patient's here, I can't fix it. We're going to look at some pain control options maybe with them. And they've probably done a bunch of pain management already before I even saw them. In fact, like I said, I've only seen one. And that patient was in a world of hurt. So, again, we're not going to be able to correct this patient. There's too much damage done. Could have been corrected here or here, but once the bones close up, there's nothing I can do except maybe some pain control. And we're not looking at getting the curve back then. I'm Dr. Lininger, and everybody should get checked for this. You should go to a chiropractor and get your kids checked, get your wife checked, get your husband checked, get your dog checked. I'm Dr. Lininger, yours in health, and you have a nice day today.